So good afternoon, and thank you for making time to join us. As usual, everything is busy. We're all extremely busy with all kinds of projects, but we really feel this is going to be 90 minutes of well-invested time as you can learn the things that we've learned over the past couple of years, about 2.5 years. As we're doing the CDSME grant, and that is what this is about. It also is, as we've mentioned, going to create the foundation for improving, building the Idaho State Title IIID program, not only within each of your AAAs, but within the state as a whole, with some coordination and collaboration to hopefully make things work a little bit easier, more smoother, and more efficiently. But before we get started, do a couple of introductions. I am Erin Olson. I think we all know each other, but you got to get that official thing done. I am the program specialist that is so happy and thrilled to be working with all of you with the Title IIID program, as well as the ADRC and INA. So kind of getting everything tied in there together. We also have with us Natalie Nathan, who is the program specialist and has a certificate in gerontology, actually, and has been really kind of the boots on the ground for this grant for the last 2.5 years, doing wonderful things through some fairly difficult and challenging times. So as the Marines say, if it doesn't kill us, it makes us stronger. We can only hope so, right, Natalie? And then, of course, we also have Raul Enriquez, who is our director with the AAA Area 3 for Southwest Idaho. And together, we're going to be presenting this information so that you can have it and utilize our lessons learned, the good, the bad, the ugly, the easy, and the hard lessons to build a fantastic Title IIID program and make you a rock star in your own program, as well as for the state of Idaho. So Natalie is going to be working with our slides here. We do, of course, have to acknowledge that this grant is funded through a CDSME grant for capacity building through the Administration for Community Living, or ACL. None of us could be doing any of the work that we do without that funding. So it's really, really important to recognize that that is what has allowed us to focus on this as we have worked through it. First of all, I'm going to just kind of give you an introduction and an overview to some of the Idaho stuff and the program stuff, and then we will kick it over to Raul and Natalie to handle the details that they have been working with so much in the past couple of years. So Natalie, next slide, please. The first thing, and this is really just an informational slide for those of us that may be new or maybe just don't think of where the funding comes from. This is really the funding stream, but it also is kind of our responsibilities when we do reporting, how we need to do that and why we need to do that. So we have really two ways of thinking about funding for Idaho. The first primarily is the Older Americans Act, which provides funding to ACL. ACL is the one that not only provides the Title IIID money, but also a majority of the grants that any of us are working with. On the state side, if we're using state dollars, there's something called the Idaho Senior Services Act that allows us, meaning ICOA, to provide services. Of course, all of that money has to go through the state legislature and be appropriated, and we're not even going to go through that entire process. But eventually, from those two primary sources, ICOA, Idaho Commission on Aging, gets funding. We then distribute that using an interstate funding formula, which again is a whole different discussion, but it goes to the AAAs based, primarily on population. So those with more people probably need more money, and a few other factors as well. That's where all y'all come into play. And somewhere between the directors and the Title IIID program managers, you figure out what your budgets are, and you allocate the money for the Title IIID program. And then you either provide those services directly, or you do have the option to contract services out, have another contractor, another organization that manages the program. But that's really the quick and dirty way that money comes up from the top all the way down through the services and providing the health education to the people in Idaho who need it. Next slide, please, Natalie. So, very quickly, and again, some of you know this and some of you don't, but the Older Americans Act, or OAA, has some basic goals, and these really are very high level goals. And it talks about working with people to keep them healthy, keep them safe, keep them from being institutionalized, those types of things. If you want to go ahead and go to the next slide, Natalie, I'm not going to spend a lot of time on these slides at all. We also are hopefully aware of some of the eligibility requirements that we have. Basically, we primarily work with people 60 years and older, but we also can provide services for anybody who is 18 years or older who has a disability. With our program, we can also provide the education for people that are spouses or caregivers or adult family members, because sometimes having them knowledgeable about the disease conditions that we're dealing with is helpful, because they live with the person, and as we said, sometimes they're the caregiver for those person. In addition, we don't necessarily target or focus on, but we do want to make sure that we are reaching the people who really need it. And those can come into a variety of categories, like people in rural communities, which this grant focused on, as well as people living alone, people who speak English as a second language, who may be from a minority group, and those types of things. So those aren't uncommon, or I should say aren't unique to this particular program, but really run for all of the programs that we provide. Next slide, Natalie. So this is the big question. What is TitleIIID? And what does it mean for Idaho, right? So when we talk about the program, and the program can be a variety of programs, as we already know, but we do need to work through it. ICOA a couple of years ago went into kind of a different model or mode of thinking about things. In addition to this, stay independent, stay safe, stay healthy, stay at home. We also created a category called universal services, and that's what this is. It is investing in healthy aging. That's simple. It applies to anybody. They don't have to come under any other categories. It's education to prevent, and to prevent, we have to be careful saying that we're going to prevent anything, but to either prevent or diminish the impact of chronic disease conditions. Things like diabetes have a lot of long-term complications that cause so many other problems in somebody being able to be independent. So that is our goal of this education. And that, of course, goes to maintaining health as we age. A lot of things that people think are part of normal aging are not part of normal aging, or at least they don't have to be. And we can prevent some of those through this education. The other thing that makes it a little bit different is that we're focusing on self-management. This is not led by medical professionals. It's led by peers, people that are, the same age group from local communities, those types of things. And it really is about what people can do for themselves. That doesn't mean that they give up their healthcare team or disregard their advice, but it empowers people to do things for themselves. It's planned and developed by you guys. You guys get to choose which program or programs you're going to offer, and then you get to develop those. But we want to make sure that we work together, so we're not all, going through these hard knocks the same way as we'll learn, and can really, be more symbiotic and work together, even though each of us are providing the services in our own PSAs, possibly in our own way. We will talk a lot about exactly, how we feel is kind of the best practices for this, but we need to remember that as the AAA and as the TitleIIID program manager, that doesn't mean that we are also the do-all person. We need to work with master trainers and lay leaders who are actually where we get the capacity that we need in order to deliver this education to everybody in all of the 44 counties of Idaho. Those, of course, are done through workshops. Some people call them classes. They usually are, 4 or 6, now sometimes 3 sessions. But again, we'll be talking about that. And the key to all of this really is to build this as a community-based effort. You know, we're going to manage it, but we need those local community organizations and people that live in the communities to be promoting these programs. Okay. So, you know, with that, there's a lot of things. Natalie's going to talk about how we can deliver some of these programs. And that is kind of where we're going to pick all of this up and allow people to do what they can do to customize this program while benefiting from collaborating together with us, and of course keeping it evidence-based means fidelity. So this is just a quick list of what we have in Idaho. Most of you may know all of this. Most of you, or some of you rather, may not, but everybody can do their own thing. And we'll be talking in the coming weeks about, you know, anything that we think may need to be added or modified to this to give a really truly holistic view of the TitleIIID program in Idaho. So with that, I am now going to turn it over to Natalie and Raul. We're going to start telling you about some of the specifics and the wonderful things that have been done over the last couple of years.
We will for sure try to encompass the last 2.5 years of hard work into a very informative session. So I'm going to turn it over to Raul, as he was one of the original grant writers for our program. He kind of knows that the grant and the intent and purpose behind it. But before that, he's going to talk a little bit about, Aaron spoke about these 3D programs, but looking at ACL's definition of evidence-based programs and what those programs are. So I will turn it over to Raul, and there you
go. So, you know, all of us as AAAs get TitleIIID funding, and so I think some of us are utilizing those funds in different ways. I think about 4 years ago, when I started down this road in developing a TitleIIID program, I didn't know where to start, and so the best, you know, the best resource for you in considering a TitleIIID program is the already vetted programs that ACL has approved. So there's already an ACL approved list that encompasses the evidence-based criteria. Now, my understanding is you can approve an evidence-based program. You can submit to ACL if you're thinking about implementing an evidence-based program, if you want to go through that work, but that would be in conjunction with ICOA's approval. So you'd have to convince Aaron, and then Aaron would have to convince ACL. So, but to make it easier for you, there's already an approved list. A couple of when we went down this road, there was a variety of different evidence-based programs we were looking at. We looked at the ACL list, and we actually were approached by an organization to take on the Living Well program. We were approached, and they had already had one in place, so it was just an easy one for us to adopt. And at that time, ICOA kind of had a very formal process to approve your evidence-based program. And I'm not sure, I don't know, Aaron, if you want to, I'm not sure if ICOA is going to reestablish that approval process. I think right now, that's partly why we're having these conversations now, is establishing some kind of statewide consistency with these programs. So, I'm not going to get into too deep into the elements. They're pretty specifically defined. That's ACL's elements. whatever program you decide to take on, it's going to have to meet this criteria. So I can go to next slide, Natalie. But one one thing I can talk about is our program. So I think I just want to start out, and I just want to commend Natalie. I think partly why we applied for this grant was because I needed a full-time person to manage our Living Well workshops. At that time, we were actually running a waiting list for workshops because there was a lot of people that wanted to host workshops. It was really difficult, and you all can probably attest, it's really hard to put other duties on already overwhelmed staff. And so we know Natalie was an ombudsman at the time. So I needed some additional support to kind of pull her out of that because she had a passion for the workshops and get her to take a chance on this project, because she was already, her schedule was already full with ombudsman duties. So I needed someone full-time to be able to manage these workshops. And I really hated turning people away. There's a lot of things that we tested out. We actually tested out a contract. I contracted with a couple of health clinics, and they were running into the same issues as us, putting duties onto already overworked staff. So we went for this grant. We actually applied for this grant 3 times. And the only thing I'd like to leave you with that is just because you don't get a grant doesn't mean it's a failure. We were actually able to use the information from the first grant in our second grant, and then the information from our second grant to the third grant. So all the work had been done. It wasn't really hard to put together because we had already went through the pain of outlining the details. And I'd just like to say it was a very competitive grant. There was only 10 that were awarded nationwide, and we were one of the awardees. And I think it's just so fabulous. I'm always excited about how Idaho has a really great track record in getting grants, and I'm always impressed by that. And for us to be 10 out of the whole nation, I think was pretty stinking awesome. The grant has a crazy name. It's the name of the grant is 2019 Empowering Older Adults and Adults with Disabilities Through Chronic Disease Self-Management Education Programs Financed by the Prevention and Public Health Fund. That's the name of the grant. But I needed to expand the program, and this gave me the funding to be able to do that. So there was two goals of this grant: is to develop capacity and then also develop a business plan. We needed the funding to develop marketing materials, to get master trainers, to establish partnerships, and also incorporate processes here at our office, and then also to come up with a really solid, concise business plan. And we've met most of the goals of the grant already. So next slide, Natalie. Yeah, so these were the grant objectives. It may seem a little odd. I would like to say we were doing just the general the diabetes classes. We added the chronic pain, and so the grant, that was the expansion of the grant. The capacity is adding the chronic pain. The reason we did that was because we wanted to have some remedy to the opioid crisis. So we know that seniors, particularly in our state, there is excluded from the opioid overprescription issue. So there is a problem in Idaho with opioids, and there's data that supports that, and where we're getting more and more, we were seeing a more and more impact on our senior population. And so we added the chronic pain. That's why in the grant you see we participated in opioid education. So it seems a little weird, but we added it in there because we wanted the chronic pain to help mitigate some of the problems with opioid. The grant was heavy in reaching rural areas, and I'll kind of get into that here in a minute. But there are some best practices, and there are some strategies in working with rural communities that we can talk about later on. So these are the grant objectives. Next. Oh, well, I would like to point out the last and final one is our final year. We got to seal the deal. We got to find additional funding to continue the capacity of the grant. So that is this year. We're looking at establishing a contract with another payer. So next slide, Natalie. So this is the outcome so far. I shouldn't say that. This is the target, the strategies, the target outcomes of the grant at the beginning of the year. So this was pie in the sky. We're gonna solve the world's problems. So this was the original in the grant, and you can see some of the strategies. It has the numbers in parentheses is a change. We had to change our outcomes because of the impact of the pandemic, and we'll go into the budget a little bit, but these numbers were established through our budget. So I'm gonna talk about how important it is to attach the outcomes of your project to your budget. So you can see there 468 registered participants, and it was a very ambitious goal, but basically we were shooting for a rate of $320 per participant in workshops, which is an established best practice nationwide. So if you do $150,000, which is $50,000 for 3 years, and divide that by $320, that's around it's around the 468 registered participants. There were some things I didn't consider when I did that, and so we had to learn kind of the hard way in establishing our budget. There were obviously, there was COVID that impacted that, but there was also some infrastructure building that I didn't consider when I put those numbers down. So, there was a lessons learned with that. So next slide, Natalie. Oh, that's you.
It's me now. So the next little bit we wanted to, so we have this grant. Raul approached me asking me to kind of take it over to really continue my passion for education, specifically geared towards our aging Idahoans. So I was already a trained leader in diabetes self-management. That was when we were approached by Qualis Health back in early 2018. So I took over this grant, was quickly trained as a master trainer in California, and then just really hit the ground running. So what the next little section of capacity building is going to be about is what we've done to grow chronic disease self-management in Southwest Idaho. Using our grant goals, objectives, we really narrowed the scope down, set an outreach plan of places we wanted to target, met with community stakeholders, focused a lot on our senior centers. They're already a very captive audience, and the senior centers are also encouraged to have education. First thing that we started doing is we got trained not only as master trainers, but then we were trained in addition as we took the extra training to then be chronic pain lay leaders as well and master trainers. So at that point in our grant, this is very early, we had 2 master trainers, and we knew that we weren't going to be able to do all of the workshops ourselves. So then we did a lay leader training, and I'll go into the implementation on our next slide of those specific dates. Part of growing the chronic disease self-management program in Southwest Idaho was really working on outreach, talking to providers, talking to our senior centers, working with hospitals, clinics, home health agencies, the YMCA, our dual eligible programs through health insurance, through Medicaid, working with Molina Health, working with Blue Cross, Blue Shield. And then in our grant, obviously, as it's affected everybody, we did run into the global pandemic, which stopped all in-person classes and really took a new, kind of flipped all of what we had been doing and flipped it on its head, and we had to adapt. We weren't able to meet in person any longer. And so what did that look like? It looked like switching to virtual formats. And does Zoom work for our aging population? Are they able to access the internet? Do they have a web equipped device? Do they even have internet in their homes? In addition to continuing to provide the workshops, the background of our growth was creating sustainability plans, writing a business plan, really looking at an outreach plan, creating marketing materials, meeting with advisory work groups. So it's not ever just this little piece of workshops that you meet 2.5 hours a week. There's a lot of other parts. And specifically for us and for our grant, those were the deliverables we turned in or are continuing to work on. So our implementation looked like a lot of your programs in the future. This is kind of the hope for you, is that you encourage your staff to participate in the workshops. If your INA staff or access department has been, excuse me, a part of the workshops, they're more likely to encourage people they talk to on the phone to attend. And that's a big selling point to encourage others to go to the programs. We did train lay leaders. We had an in-person training in June of 2019, and we were able to train 8 lay leaders that were then able to facilitate workshops. We just completed a virtual lay leader training last month. We'll have to look and see where are we. We're in October. It's the end of October already. And so creating more leaders, especially in rural communities and even in our urban populations, allows us more space and to continue to provide extra workshops. We have an advisory work group, and we've gathered once so far. They've also received our newsletters and we all reviewed our business plan. They provided some really valuable feedback and input in places that we could continue to offer the workshops. It also creates a really incredible network. It's more people that know about these programs that then can tell their groups, and then it just continues to spread. We also participate in a lot of outreach events, community health fairs, the drive-through vaccine clinic where we're handing out our resources. We are in a baby boomer health fair coming up, and we've been before, always providing information about our workshops that they can always call, send an email, and they will be connected to the next available workshop in their area. I've made, and maybe you've seen, a couple of very informal invitation videos of, it's me, I'm going to be teaching these classes. I want to welcome you into the Living Well program, and I want you to participate. We have invested a lot, and I've spent a lot of time investing in our community partners. We've met with local clinics, hospitals, like I've mentioned previous, the dual eligible insurance plans, with the senior centers, with churches, with the YMCA, with a lot of different aging programs, with Learn Idaho, which is both a work group for the community, but also a work group for professionals to give information. We've worked with them all, one, so that they know about the area agency on aging and what they do and the services we provide to the senior population at large, but also so that they know about these workshops, and that then they can tell people that they know to participate. I've gone recently to and targeted some marketing materials to senior communities, senior apartment complexes, senior housing developments that usually have a community room, and they're a great resource because they're already gathered there. They know that location. If there's somebody in that community bringing you in, you're already a trusted individual, and people are participating that way. And then some of that implementation meant switching to a virtual format and changing the way that we provided our workshops. It was not easy, but it is doable, and it is a really incredible way to provide and continue to provide health programming amidst a pandemic. Or in this, we're about to hit winter and snow and driving, and maybe driving on snowy roads is not exactly the safest thing for some of our participants. So we're able to offer a virtual workshop so that they can still participate, but safely from their homes. So I'm going to turn it over to Raul to talk about the budget, and I will put up our budgeting tool.
Well, so I don't think most of you would know that your budget establishes what your priorities are. Your budget dictates to you what's feasible. So I think what I've seen over my 20 years of experience in this field is that AAAs can tend to sell themselves short when it comes to their ability to implement certain projects and the cost to them. And so when I first started in this with this health promotions, with this 3D program, everybody kept telling me $50 a participant. And I didn't, and asked around, well, where did you get that number? And really couldn't get anyone to really tell me why, what dictated to us or to the organization that it costs $50 a participant. Well, we know, and there's available to us, is a pretty good study on this program, that it's going to cost you staff time, materials, and all the infrastructure that that it takes to support a project like that. It's going to cost you around, out of all the organizations that have done this project, on average, best practice is $320 a participant. So whatever budget that you come up with, and I'm going to give you an example here, that would be, for me, your measurement of what's a true cost. So this is a very simplified budget that I came up with, and there in the documents that we provide to everybody, in the packet that we're going to provide to everybody, you're going to see two budgets. The second one was developed a long time ago, and it's the one that I used for this grant. But I wanted to break it down a little bit, simplify it a little bit, because that budget that was put out tool is pretty complicated. It's pretty intense. And so I just wanted to give you a snapshot. If you wanted to do the more complicated one, it's going to be available to you, but I would suggest at least starting with this. The first part is basically what you can assume is going to be some of your costs. So you're going to need staff to be able to facilitate these classes. You're going to need staff. Even if you were to have volunteers, you're going to need a staff person to manage those volunteers, which includes scheduling, following, training and all that. So basically, this is for a part-time FTE. This is an example of another project that we have going on, but it's the same. It's done the same way. So I have a half FTE. There's considered marketing. Now, normally marketing for us is one of the staff creating a flyer. And what I've been finding is that costs money. It's for people to create flyers. And so I wouldn't spare the expense of hiring somebody to do some marketing for you, because it's going to be what gets people to your workshops. That's the one thing we've learned is instead of having, some part-time intern do your flyer for you, consider at least hiring someone to professionally do it for you. And I realize that's an added cost, but I would suggest that you consider putting some funding towards your marketing. Workshop leader costs. Now it's going to cost money to send someone to get master trained. Also, it's going to cost money for your master trainer to go ahead and turn around train lay leaders. Those are all added costs to these workshops that, in a sense, support the participants that are attending these classes. Also for the workshop, there's a cost for the books, office supplies, all those factor in. I'm trying to remember, Natalie, I think it's $25 a book, right?
I think if you buy in bulk, it's about $17 to $20.
Yeah. So that can start.
You also need the CDs as well.
Yeah, so that can start to add up the more classes you do. So something to consider. Some AAAs, we don't do this, but it could be that you have the participant pay for the book as well. But we offer it free. If you look at the bottom, your budget should be controlled by the average cost per person. So in this example, we have a cost per completer goal. So we're a little ambitious with this project. We want the completer, not the participant, to be at 320 a completer. That's above average. That's better than average. But for the sake of developing a budget that's based on best practice, you could do 320 a participant, not a completer, because you're going to have people drop off your class, and it'll raise the average. You have basically three numbers on your workshops. You have the people that register, you have the people that actually attend the class, and then you have the actual people that complete the class. I would, if you're considering doing this project, is you base your numbers off your participants, the number of people that actually show up to your class. That would be a good measurement of how well you're doing as a program. So this budget that I came up with, it's more geared for if I have a contract with somebody to do the classes for me. So if I'm going to provide staff, to it, it's going to add to the cost of the classes. So, so Natalie, where it says in the middle, area 3 support costs, just go ahead and put, I don't know, $10,000. So if you notice at the bottom, it says with area 3 support. So it raised the increase of the completer cost. So I didn't want to get, I mean, I'm obviously going too deep in the weeds. The main point is, and I'm more than happy to do a follow-up call to advise you on establishing a budget for this. I've done it a bunch of times. I'm more than happy to provide some guidance on establishing. The main point is take the time, consider your costs, and make sure that it's attached to reasonable outcomes. So that's all I have. I don't know if we have, I don't know if we take questions now. Is this a good time? I don't know. Do you have any questions about that? I'll go ahead and ask, I guess.
I was just going to say there's just not too many of us. So if anybody does have a question, go ahead and unmute yourself. If you're not able to do that, you can also raise your hand. That might work as well.
Hey, Raul, where you're coming to the end of this grant, what's your projection for it carrying forward?
Well, I have enough in TitleIIID funding to support this project moving forward. Natalie, it might fall more on Gabby's shoulders to to organize the workshops. Natalie is trying to meet the deliverables of this grant, but the actual workshops, it'll be a shared role between, right now Natalie's doing it pretty much full time, but it won't be as you know, workshops will continue with TitleIIID funds. Now, you know, our objective is to get more funding. So we're gonna, the objective of this year is to meet with payers and establish contracts so that they can subsidize the cost. Now there's other different ways that we can continue. We have volunteers, so it doesn't always have to be staff. So our intent is to continue, and also, well, we'll talk about outcomes later. So
thank you.
Great. Before we move forward, I wanted to go back a little bit on this implementation and explain one other key point. So I was trained as a lay leader in diabetes self-management in February of 2018. I was then master trained through the Self-Management Resource Center, SMRC, in September of that year. We officially received the grant in May of 2019. And at that point, I was, up until about May of 2019, I was doing kind of both roles. I was, as Raul mentioned, working as the ombudsman, doing the diabetes self-management classes, and we had a very big need and want. A lot of our senior centers, some local churches, they had heard that we were starting to do these programs, and there was a lot of demand. And so up until the pandemic and we took over the grant, there was a lot of interest, and we had quite a few workshops lined up in person before March of 2020. So I wanted to make sure that that was clear. There were a lot of workshops happening before the pandemic kind of closed things and changed some of our delivery methods. So once we took over and took on this program, it meant creating some marketing, really going out and doing a lot of different outreach. And what did that look like? Raul mentioned that spending money to have a good marketing person is a very, it's nice to have. I learned on the fly and created a lot of materials myself. I used some online templates through Canva, which is an online program. I used PowerPoint and made flyers, made postcards. I made wrap cards and had them printed. And these all became things that were then sent to our senior centers, sent to churches, to our community partners. They were handed out at health fairs. We put ads in newspapers when we were recruiting for our lay leader training in June of 2019. I made Facebook videos just using my cell phone as, maybe, gosh, it's not very fancy, but it worked really well to kind of get the message out there. We used social media. We used a lot of different methods, and all of these examples will be available to you in the share drive that will be coming after the presentation. So you'll be able to see some of the flyers I created, the newspaper ads we ran. You'll get links to the videos. You'll see the things that we put in our home delivered meals. When we switched to fully virtual workshops, the best way to get things out to our consumers was to put a flyer in each home delivered meal. So working with our community, our meal providers, our senior centers, the community centers, they all stuffed every meal with a flyer. And we did get quite a few people registered for our virtual workshops that way. We have wrap cards available that are handed out at each workshop, in addition to posted at senior centers, given out at our health fairs. There are postcards created, and they have a special little part, which we'll talk about later. And then I started also printing poster size flyers so that it can be posted in the senior center. It's a little bit larger, it's more eye-catching. And again, all of these examples are going to be in your media toolkit that will be available to you after the workshop. Some of just a quick sample of the things that I've made and we've been a part of. I used Canva to create these Living Well flyers. Are they maybe the most fancy? No, but they actually, I think they get the point across. They are very easy to read, which will be part of our best practices, lessons learned part. We do participate in health fairs. We make sure to include our logo so that people do know that we're associated to that. And those are some of the things that we advertise our workshops at. And this one happens to be out in a rural community in Marsing. They have a education center, and it is in our outreach plan and in process of hosting a workshop there. So we've talked a little bit about delivery methods and different ways that the workshops have been taught, both pre-pandemic, post-pandemic, and well, still in the midst of pandemic. So there are kind of two main ways that these workshops can be presented. And the first is our in-person workshops. We meet either at a senior center, a home health agency. We've had workshops in hospitals and churches, at the Meridian Library. We've had classes at a community health clinic. What that looks like for your individual areas is really up to those specific communities. Each location's a little bit different. An example, the YMCA, they have their own marketing team. They like to create their own flyers. They have a registration system. And so they do that part. We provide the trained leaders, we provide the books and the workshop materials, and they do the registration portion. Ideally, that's the best way to have a workshop. They're doing kind of the bulk of that work of recruiting participants, and you're providing the leadership of the workshop, and as well as the materials. We've also done registration where they'll call either me or Gabby and they'll register either on the phone. I've done Google Forms so that I can compile all of the registrations for in-person classes. The senior centers like to keep a list of who is registering for their workshops. And then I will check in with them, get the number of participants, get their information, send them the welcome information, remind them of the class, and then make sure I have enough materials. When you are hosting an in-person workshop, and specific to the Self-Management Resource Center workshops, there are things that you need to have before you can begin. In your media kit, you'll see I created a really simple workshop sign-in that, each week everybody just checks off the week that they're at the class. You do need to have the workbooks ready for your participants, any worksheets. The diabetes workshop in particular, there's 2 kind of homework assignments that you'll want to have prepared. The relaxation and meditation CDs. I keep those for the end of the workshop so that when they're finished, they get a completer's certificate and a CD kind of as a thank you for participating and being a successful completer. There are a lot of different ways to utilize the resources that you have available to you for in-person host organizations. Kind of think outside of the box, but also don't reinvent the wheel. Senior centers are a great place to have the workshops. They have the space available. And if you work the time around meals, you're picking up a couple of participants that might be there before lunch and you're catching them as they're leaving. And so you're creating another space for our seniors to not only learn, but to gather and to be together. And that's especially important as we're out of this pandemic isolation and more people are really wanting to be together and really need that time together. So in addition to in-person workshops, we can also host them virtually. And this looks a little different for our participants. It means that they do need to know how to use Zoom or Microsoft Teams or Google Hangout. Not only do they need to know how to use those programs, they also need to have a device that has a camera, that has a camera, a microphone, and has access to the internet. For some of our seniors, that is the challenge. Not to use the program, but some don't have a device that's capable of those things, or they don't have reliable internet service. SMRC also has, in addition to the virtual programming, they also have a phone workshop that is available if you're trained in the CDSME suite of workshops. You can pull from their resource guide a phone style workshop as well. We have not done that because we did switch to a virtual format and used Zoom specifically. When you are teaching a virtual workshop, instead of being at the center with all the books and everything ready to go, you instead have to mail everything. Or if it's local, maybe drop them on their doorstep, which we did during the pandemic. I was like, it's contact-free delivery of your materials. And that worked. They received all of their information, a welcome letter, information about our office, the Living Well program, all together. And then another piece of mail was sent with their completion certificate and the CD. It also means the registration timeline looks a little different because you have to make sure that their materials are to them prior to the start of class. So cutting off registration about a week before, or putting some kind of note of, you can register up till the start of class, but you won't have your class materials at the start. And for the most part, most of the participants that have been in our virtual workshops, that was fine with them. I like both modalities of teaching. Virtual has its pros of, you can really access the entire state. So if I am a trained leader here in Boise, I can work with a trained leader in Twin Falls or Lewiston or Idaho Falls, and then we can pull groups from all of those areas and meet together. It provides a space for meeting when a senior center or when a community center is closed. It also just allows kind of different people to work together and to create community. Especially in that pandemic time, it gave people a space to meet and to see somebody, even though it was via screen. In-person classes also have their benefits because you are able to gather together. And so it really kind of have to weigh the benefit and know your community and what will work best. We did kind of compile our last year's workshops, and you'll see that there were a couple via Zoom, a couple workshops in person, and one that is still in progress out at the Parma Senior Center. And for the most part, participation virtually hasn't been as high as participation in person. That doesn't mean that that's always how it will be or what it will always look like. Maybe in your area, there are more people that are interested in meeting online because it's a little easier for them to access. There's no driving involved, no transportation needed, and they're able to do that from their home. And for some, they might prefer to be at the senior center or at the library or the Y or wherever you might have a workshop. So to think of really knowing your community, knowing the locations you're going to be teaching workshops at, that has been most helpful for me and for our program. So over the last year, we've done both, and we will continue to do both. I anticipate doing some virtual workshops in the winter, again, to keep people safe at home and not driving on icy roads.
Natalie, really fast.
Yeah.
You have 2 of your sessions where there was only 1 person registered. Is that, do you feel as effective when it's just a one-on-one as opposed to kind of a group guided teaching?
It's not, that's a great question. So the number of people registered initially was more, and Raul kind of alluded to that. You have the people that are registered, the people that attend, and then the people that are workshop completers. And so we started that workshop because there were more people initially interested, and then only 1 showed up. At that point on Zoom, you lose some of that learning from others. And truly, through SMRC, they want you to have more participants to start a workshop. At that point, we were kind of still working through the growing pains of using Zoom. It could have been canceled. We still learned.
I think normally we would pull the plug on that, Brian. I would not recommend doing one participant classes. We've been flexible this past year because of the pandemic. Our numbers had been lower. It was a lot more challenging to get people to meet face to face. So in a non-pandemic world, you wouldn't hold that, but it's also virtual. So you don't have travel costs, you don't have the cost of the facility. So it wasn't, I think with that one in particular, we decided just to continue for the sake of that person. So. Well,
And the
actually,
same-
no,
And the same with the Caldwell YMCA class. There were initially 8 people that were interested and registered, and that's why we started the class. And the just attrition rate, we've also found that there are just certain months that are better to host workshops than others, and that we will talk about in the kind of lessons learned and best practices section. I did see a hand raised.
Oh, Natalie, that was me.
Okay.
That's Pam in Region 1. And just in regards to number of registered, since we are doing the Mind Over Matter, Healthy Bowels, Healthy Bladder, evidence-based program up here in this region. And I do know in terms of registrants, they've been very prescribed that we do not hold a class with less than 6. In terms of maintaining the fidelity of the program. So certain programs that we embark on under the health promotions and evidence-based are probably going to have those prescriptions in terms of the type of results that are yielded. That said, that didn't stop us from going back to our overarching entity who certified us and saying, hey, here's our situation. We'd like to serve these people regardless. And they've worked with us a little bit about that, but that is kind of something to keep in mind for various programs. They may all have very specific instructions.
Right.
And this is Erin. I'm gonna but in for just a second, which is to take over what Pam was saying, which is that you're absolutely right. All of these programs have a designation of a range of attendees, but with COVID, I believe all of them have been a little bit more lenient about that for all of the reasons. So we don't want to get into that habit, but there have been exceptions, and we'll have to see. There's probably going to be a point where they're going to say, okay, all of the exceptions are over. We have to go back to the standards now.
Right. And when I do schedule workshops, I do tell all of the host agencies, the senior centers, we need at least at minimum 8 registered, up to, we've had a class with 20. That was prior to the grant. 20 seems to be a lot. So that's between 10, 8 and 10 to about 12 to 15 is a great workshop size. And so usually, and both Erin and Pam, you're right, we don't hold workshops if there's less than 8 people registered. In those cases and during COVID, we have been a little flexible. There has been some leniency in those numbers.
For sure.
Yeah. So because we are getting closer to the end of our time, I want to just go through some of the ways that these programs have been evaluated, and for you as program managers to evaluate your program. So we have chosen to use some of the self-management resource center programs. They do have an implementation guide. They do use a fidelity manual. On their website, there are surveys and a lot of valuable information that you can use to evaluate, is this program working? Is it not working? For our specific grant, we used the data collection tool that is provided to us and was required for our grant. I think on your screen, these are probably very small, and so probably very hard to read. But as part of our grant, we were required to collect some very specific demographics information. One, did they have chronic diseases? And which ones did they have? What was their race? Did they have other hearing difficulties? Were they living alone? Information like that. Did they feel at the beginning of the workshop that their health, where was their health? Was it excellent? Was it poor? Where they felt they laid. And then at the end of the workshop, you did a post workshop survey to see if their health, if they felt that it had improved. When we started going to the YMCA, they're like, do you have any other data that you collect? We want to know a couple of other questions. And so as we move forward, and we are no longer going to be uploading this data into the database for ACL and NCOA, we'll want to change the way that we collect information and change our survey for a pre and post survey in our workshops. And just as a quick aside, this is what ultimately, this is what ACL is looking at. They want to see how many participants we've had over our grant period, how many participants and how many of those have been successful completers of the program. So we wanted to include that. When we were doing our virtual workshops, you can easily create a Google form with the same survey questions that ACL had required, and then adding things like, how would you rate the time and location of the workshop? That information only helps to improve your program so that you know, again, your community and what they're wanting, what's going to work best for them. We have really worked to start a Spanish, diabetes, and chronic pain workshop, and we're finding that hosting those during the middle of the day doesn't work. And so we're having to reevaluate the time and location of those workshops, but we wouldn't know that unless we asked those questions. How would they rate the leaders? Were they great leaders? Were they poor leaders? If you are using volunteers, that's a really important question for you to ask as a program manager, so that you're able to see, are these volunteers, while they might have been certified and you've taught them to be a good leader, are they really living up to those expectations? Are they presenting those materials well? And then how likely are our participants, how likely are they to recommend this workshop to a family member or a friend? That word of mouth invitation is a big way that we continue to gain more people as completers, to put more people in through the workshop, get more people in the classes. And so we want to know those things. Maybe asking also in that survey for additional comments. So you can use Google Forms or create an Adobe form, whichever might work best for your agency, so that we are asking these questions. And then so we've done all of our data so far for ACL for this grant period. All of our data is going into a specific grant database, but we all in the state of Idaho use GetCare. And so there is a place for us to put this information, the workshops we're teaching, the number of participants into that system, so that we're really keeping track of the programs that we're doing. And Raul is going to briefly touch on that, kind of where those are going.
Yeah, so not a whole lot on this. I mean, this is probably the only program that's pretty loose in the data recording. ICUA maybe at one point may define this for us, but right now it is Title IIID programs are open-ended. So meaning you define what a session is. Now, Erin's fairly new to her role. She may at some point have us define it a certain way. The GetCare, the unit count in GetCare for Title IIID programs is a session. And ACL, I put the definition, ACL's definition in here. They don't define it. And the reason they don't define it, what a session is because there's many different ways you can do Title IIID. So a session looks different with the MOM program as it does for Living Well. So a session is based on, honestly, what you define your performance is. So in our case, we define performance based on the number of participants in the class. So we don't put a unit every time a person goes to a class. We put a unit in after the person completes the class. So So I'm giving you this example only because that's what we've defined ourselves. So in this case, in July 2018, we had 12 people, or I'm sorry, 11 people graduate from the class. So you do have the option of doing non-registered. We at one point were registering them now in Get Care, but now we're doing non-registered. So it's kind of up to you how you want to track it. And the reason we do non-registered is because we have a different software system that Natalie talked about that we incorporate data in. So it's double entry for us right now. But this is an example of what your 3D program could look like. That's the data set that we've established for our Get Care. And I think that's all I really had for Get Care.
Raul, with this session, on your example here, it says registered and non-registered. So you're only counting individuals who fully complete the course, not everybody who's registered and completed.
In this example, it is just the ones that completed.
Okay. All right. Understood. And as of right now, there's no stipulation that we have to put the individual's names in to Get Care. We can just count them as a total number.
Yeah, you define it yourself
This
right
is
now.
this is Erin, and I think we're going to take this discussion off this particular seminar, and it's a whole discussion on its own, so that we can make sure everybody's clear on how all this works. It's complicated, if that's okay.
All right.
Okay.
So when you have your own programs, you will have some sort of data entry into Get Care, and what that looks like we'll define at a later time. Once we've taught the classes, once we've had our workshops, then we need to follow up with people and to continue to engage people. And I alluded previously to a postcard. And so part of our grant deliverable was to create this ambassador program, or to create some way to engage past participants and to keep them connected to the program. And so I made a postcard that, as we have our completers, they finish the class, I give them a stack of stamped postcards to then invite other people to the workshops. Hey, the postcard says, I just finished a Living Well workshop. I think you'd really enjoy it. But give Natalie a call or an email, or send her an email, so that you can also live well too. And I've gotten a couple of people that have registered because they've been invited by their friend to the workshops. So this is just one way to create that word of mouth marketing and advertisement. And that personal invitation is a really big part of that engagement. And you'll also have the example of the postcard in the dissemination kit. Another way that we've kept people kind of together is using an advisory work group. We've gathered quite a few stakeholders from the community. We've used the Aging Center, the Center for the Study of Aging at Boise State. People from that group, from our insurance companies that run those dual eligible programs, other seniors that are on our staff that have been through our workshops. We've used them in the advisory work group. We've created quite a large array and a good umbrella of people to, again, continue this word of mouth and networking. And it has created a network of sustainability, so that these workshops at the end of this grant, like Raul said, they're not going to end. We will continue to have Living Well for hopefully the foreseeable future. We've also learned some things. We've tried, we've failed, we've succeeded, and Erin's going to talk a little bit about what those growth challenges have been.
Exactly. We'll let Raul and Natalie take a breath. They've been kind of waiting for that for almost 3 years now. It's been a lot of fun. There have been stumbling blocks, but I'm very proud to say that we may have stumbled, but we haven't fallen. We have some scrapes and some scratches, but we're still in the game and stronger for it. So we do now want to get to the point of lessons learned. Now, I want everybody to understand we have encapsulated, this 3 years of work in an hour and a half. So of course it's not all of it. And we know there are several topics that we will want to continue talking about. Likewise, these are just a few of the lessons learned that came up. And there are a lot more that we'll be sharing over time. But to get us started, I just want to know or let you know what kind of our challenges have been recently in the state of Idaho. And I broke them down into categories. The first is when we talk about demographics. I'm smiling now because we have independent citizens, and I have to give the shout out and credit to Brian, who said that in a phone call just last week. He said that some of our populations in certain areas are fiercely independent. So I like that word, and I'm going to give Brian credit for that. It can create challenges from who are you and why are you coming into our community trying to teach us things that we didn't ask you for, that kind of stuff. And also that they often like to do things on their own and don't seek assistance when they need to. We also deal with some cultural and ethnic minority groups, which just sometimes need to have things presented in different ways. We have to be culturally sensitive to things like that. And a broad sweeping generality is there are in many areas, hesitancy to do anything that has a government stamp on it or even the kind of part of it. Geographically, though, this is stuff that we all know. We're a large state. There are only a few population centers really, and the rest of the people are spread out over a huge area. And it's those people that aren't in the population centers that we need to be reaching. And of course, they're the hard ones to reach. We can't send a person out once a week for 6 weeks to talk to 2 or 3 people like we were just talking about. So either getting people involved or doing virtual where we can pull people from a lot of different places more easily is going to be the easiest way. Also, because of the way our state is, we have sort of a north-south route, kind of an east-west route with the interstate, but everything in between is a little bit harder to get to. You throw in weather and it just makes it more difficult. Internally, though, we've also had some changes that have made this difficult. It's been 4.5 years, I think, since we had a change in administration. ICOA has gone through a lot of changes and putting into place processes and things for these programs. So that's been a challenge. We've also had some, shall we say, significant overturn in our AAA staff. In few of the AAAs, which means we're just bringing on new people, which is great, but we all have to be trained up on how to do this. And then, of course, as we've mentioned, and I hate to see it, say it, the C word, COVID has presented a lot of challenges, but it has allowed us to do some new things. I think that's exciting. So that's where we're going to really take off from there, tackling those things together. And we're now going to let Natalie finish us off with her idea of the best practices and lessons learned from her experience in the last 2.5 years.
Yeah, so Erin mentioned the COVID. We have to be flexible, whether that means wearing masks within our centers, because that is what they're asking, using a microphone and voice amplification system so that our seniors are able to hear us, or our participants in the workshops are better able to hear us, or using a clear mask so that if they need to read your lips, they're able to do that. Workshops, again, you don't have to reinvent the wheel. Senior centers, churches, hospitals, clinics, they're all really great resources and available, and typically have available space to host, and use those. use them to your advantage. Train at least 3 to 4 people as master trainers, and then train a lot more lay leaders, because the more people we have as trained leaders, the more we're able to have workshops. Also, be mindful if you are using paid staff to be a leader for this workshop, be mindful of their other job duties. It's really hard to do both and do both well. Simple marketing lessons that I've learned, Canva has been a really great resource. Simply because you're able to, if you have the paid membership, which is fairly minimal, you're able to resize flyers and print things, download them as PDFs and send them to a printer so that it's easily accessible, using PowerPoint as marketing, creating some templates as well. And then again, those simple Facebook video invites and using social media as a quick and very powerful marketing tool, boosting the posts so that more people are seeing that invitation. It's a really awesome way to invite people, and the videos are short. Again, it doesn't have to be anything very fancy or highly produced. And then using that advisory work group, collaboration is key. The more people that know about these workshops, the more people are going to send people to participate. And that is such an important asset to your health promotion program. Some of the things that I've learned as best practices is these workshops take a lot more time than the 2.5 hours a week that you're teaching them. So plan accordingly, especially the week before a class starts. It's gathering materials, printing the worksheets. For us in particular, it was also working on these grant deliverables, writing the business plan, doing the outreach, working through putting together the dissemination toolkit, doing media, writing flyers, writing welcome letters and emails, including our senior centers, getting all that information out. It takes time, and it's not a simple, you just teach the class. There's a lot more involved to it. Having things ready, having your workbooks ordered ahead of time, having the CDs ready and available to you. For Zoom, the best practice that I've seen and what I've heard throughout kind of our grant calls and other areas that are using virtual workshops, Zoom has been the most effective. I mean, we're on Zoom now. Why is Zoom the most effective? You don't need any particular registration. You don't need to have Microsoft Outlook to join Teams. Zoom is a very simple click and join, and that has been easiest to help our participants join the workshops. It also has the ability to use a blackboard or a whiteboard, which, as we know in our SMRC workshops, we do a lot of brainstorming. So you're able to type out the answers as we brainstorm. It also has the ability to do breakout rooms and do them easily. And if we're doing kind of the shared feature throughout those workshops, you're able to separate the participants. I already mentioned training more than 2 people because things happen. Erin mentioned staff turnover, people switch jobs and they're no longer able to lead our health promotion workshops or Living Well program. And so we need to make sure that if somebody is not there, that we're able to then have someone else that's able to kind of absorb that work. Utilizing our community partners. There's a lot of community partners that are really valuable to our programs. Working with Blue Cross Blue Shield, Molina, the hospital systems here, they want people in the workshops, and they're also a lot of times willing to send people to be facilitators for our workshops as well. And then creating marketing materials that are accessible. So what does that mean? Making sure that someone who's visually impaired is going to be able to read it. So not using red font, that's really hard to see. If you are using white font against a black background, make sure it's outlined so that they're easy to read, creating materials that we know our population is going to be able to use and to actually gain from. You will be receiving a link to a dissemination toolkit, which is just a large file of everything we've done over the past 2.5 years. I know we're getting really close, but in that folder, there's an administration folder. You're going to see the business plan, the sustainability plan, the outreach plan. This webinar recording, SMRC has links to their webinars about teaching a virtual plan or a virtual workshop and doing that well. And what does that look like? You'll see in the workshop folder the registration forms, attendance records, Zoom instructions that I've written, Zoom instructions that SMRC has put together, an example of a completion certificate that I've created, the workshop survey through Google Forms so that you can kind of see what that looks like as well. And then in the marketing folder, you'll see all of my attempts at being a graphic designer, and use them if they work for you, and if not, create something new and then share. That I think is the best way to make these programs work. We are a state that is large, but when we work together, we work better. So share our information. This is why we did this webinar, so that you can see what we've done and use some of the stuff that we've put together and we've done for this grant and use it in your area, and then come back together to say this is what's working for us, and to really grow our programs and to help everyone throughout the state live well. I also included just an acronym glossary. We say a lot of, SWIA 3 and CDSME, and so that way you kind of know what those are. And I also included in this webinar a resource page, one that links you to those ACL evidence-based programs. So if your area wants to not do the diabetes self-management class and instead wants to do Tai Chi for health, that's a program that is available to you, and you could use TitleIIID funds for that. I've also included a couple of different YouTube links for videos through SMRC. The Self-Management Resource Center has a lot of information as well, and you'll get a link to this webinar as well as the dissemination kit with all of the things that we've put together for you.
Natalie, if we can go ahead and go to the last slide, we are out of time. So what I'd like to do is I'm just going to do my final slide, and then we'll go back for any of you that want to have some questions. So thank you for that. Whew. Now, the good news is that you're all excited and ready to work on your program. What are we going to do next? First, continue to book and hold workshops like you've been doing. That is the best thing that we can do to get information out to people and continue that work. Also, review that dissemination toolkit that Natalie just talked about. It literally is packed with 3 years of work. And so it will save you a lot of time, and also perhaps for some of you that are new, help you understand kind of what needs to be done to build an effective program as well. I would like you all to request membership to the private Facebook group that we have created. It is for the TitleIIID program in Idaho only, and only for those of us that are providing the program. So it's where we're going to be able to ask questions, get answers, discuss things, share successes, those kinds of things. I did give you the link, so you'll be able to follow that. Then we're going to begin that collaborative process of building a robust, sustainable, community-based TitleIIID program in Idaho. That's what this is all about. What we're going to be doing is I'll be sending out an email to help us schedule twice monthly collaboratives where we're going to get together and we're going to start from the ground up. So those of us that have built programs can share and share that expertise with everybody. Those of us that are new to this process can start with a good foundation and build the program up over the next, year or so. That's what we have to look forward to. And now, with that said, we'd like to first thank everybody for investing the time to be here. It really is a a starting block, and hopefully it has you all inspired and ready to do wonderful things. But now for those of you that can stay, we'll go ahead and back up and be willing to take any questions that you may have. So
I don't have a question, but I think Natalie and Raul, they did a great job. And this looks very helpful as we look at expanding our programs. You guys did a great job. Thank you.
Thank you. And we could talk about, I could talk about living well programs all day. So condensing it into an hour and a half was the challenge.
I know, that's what I was saying. It's like, and you would say, oh yeah, yeah, yeah. And then there's this and this and this and this and this, but it is hard to encapsulate.
Yeah, just if any of you have questions afterwards, we're more than happy to help. We definitely learned a lot during this process, and yeah, we're available. Call Gabby first. Just kidding.
Well, if there aren't any more questions, then we will go ahead and say thank you and goodbye for now. And we will be sending out the links to the recording. And of course, we will all be in touch very, very soon.
Thanks.